Hi, everyone. Thanks for joining us today. I am here with physician assistant Gerald Simons. He is a PA at the Morrison Center in New York. It's an integrative health center in New York City. He is nationally certified as a physician assistant with commendation in both primary care and surgery. He's considered a Lyme expert and he does speaking, writing, teaching. He is really quite good at what he does. And we're very pleased to have him here today to talk to us about an irritable bowel syndrome case for Omni-Biotic. Take it away.
Great. Yeah, thanks, Michelle, for the introduction. So, I want to share with everybody out there how both dietary modification and probiotics helped to change a 33-year-old woman who was a pretty well-known teacher in our community. So again, if you're taking notes, you know that irritable bowel syndrome is the most commonly diagnosed GI condition out there. So most of you are probably seeing a lot of people with irritable bowel syndrome or with, these symptom complexes that you're still trying to put a label on, right? Because we know when we talk about a syndrome is specifically described in terms of what symptoms the patient has, right? And syndromes, of course, have characteristically complex array of symptoms that go there. And, very important to remember that when you're diagnosing someone with irritable bowel syndrome, that they do have to have abdominal pain and they do have to have some kind of changes in defecation, whether they have constipation or whether they have diarrhea or whether it alternates between constipation and diarrhea. I've had a few cases where patients have said, oh, my former practitioner said I had a really bad case of irritable bowel syndrome because they didn't really have any other idea what I had. I'm like, oh, you have IBS. Tell me about your abdominal pain. They're like, well, I really don't have abdominal pain. I'm like, then you probably don't have IBS, right?
Yeah.
Much more common in women than men. And what I thought's interesting about the case that we're going to talk about is we know that about half of the time we figure it out before the age of 35, but also about half of the time people can grow out of their IBS over 5 or 6 years.
Interesting.
So, so those are like some core facts when you're thinking about, is this IBS? Is this just some kind of small intestine bacterial overgrowth? What's actually going on with this person's pain? Is it actually inflammatory bowel disease like Crohn's or ulcerative colitis? So this 33-year-old teacher fits in that first category of patients who present under the age of 35. And she pointed out that in college, she started noticing that she had much more diarrhea, that she was developing loose stools that actually was affecting her ability, like when she was taking exams or, living with a roommate in and out of the college dorm to go to the bathroom. And she had grown up in a relatively healthy household with lots of whole foods and green veggies. And I think all of us have seen when someone gets into college and they start eating that, that cafeteria line food, and they might definitely
everything goes out the window.
everything goes out the window, at least for that first year. And so she kind of like chalked it up to that. And like many kids in their early 20s, they would chew on some Tums or they would take Pepto-Bismol and not really think that much about it, really. So what I thought was interesting is when, I really dug through her history, she had with her family been on a safari as like a high school graduation present.
Mm-hmm.
And, it was possible that she might have picked up something parasitic.
Mm-hmm.
And we know there's a lot of really good data that shows that there are about 20% of people with irritable bowel syndrome. It could actually be triggered by an episode of gastroenteritis or
Mm-hmm.
some type of parasitic type infection. So, Michelle, I definitely encourage people as you're interviewing people with chronic abdominal pain, with constipation, with diarrhea, really look back to see if you can find one of these triggering events. As I said in the beginning, there's actually a lot of good data with SIBO, small intestine bacterial overgrowth, and gastroenteritis as being like a connection, right? So more and more, we're looking at very subtle parasitic or infection type markers for helping us figure out not only if someone has IBS, but also a little bit about like what we can do as a treatment or a different type of intervention. Most people know that I have a special interest in the parasites that are transmitted by eating pork, like Trichinella, Taenia, Toxoplasma. There's actually a funny website. It's not a funny website, but it's called thepigsite.com, where they have reports on pork parasites and things of that nature. So I also do a good inventory on how much pork people eat, like on a regular basis.
Got it.
Interesting. So anyway, so we're talking about this 33-year-old teacher who in her early 20s in college started developing loose stools,
Mm-hmm.
which I was able to figure out might have initially been triggered by this African safari and some of her classic, diet, like pork, for example, maybe a lot of undercooked veggies, things of that nature. And she had seen her regular primary care doctor who had tried like a low dose of antibiotics and encouraged her to do low residue diets, and nothing really seemed to help that much. She had actually never seen a gastroenterologist because she would have like intermittent flares where the diarrhea would kind of act up. She would fast a little bit, eat more fluids, take over-the-counter remedies, and it seemed to kind of kick it in.
Mm-hmm.
And what's interesting, I think, is what brought her to us is she did experience COVID. And after COVID, she noticed that she was having a lot more abdominal pain,
Yeah.
which was kind of a prodrome to these diarrhea episodes. And she was having much more of a stronger reaction to foods that would make her feel gassy or bloated, especially like roughage and things like that, which eventually was giving her a lot more anxiety, almost to the point where she's like, I don't know if I want to go out on a date. I don't know if I want to go to my teacher's conference because now I'm very nervous about having diarrhea, when I'm out in public. And Michelle, one of the most famous medical websites called Up to Date, when you read their little section on irritable bowel syndrome, Up to Date has a really good section on the gut-brain connection in irritable bowel syndrome, which when I read that, I'm like, wow, this is really moving into the forefront of more mainstream kind of medical types of knowledge. You know what I
That's
mean?
awesome.
Yeah. So, so when she first came to me, in addition to, looking at stool testing and blood work, which we'll talk about in a minute, I tell all of these irritable bowel, chronic abdominal pain with constipation or diarrhea, I'm like, have you ever really tried like 2 or 3 weeks without gluten and 2 or 3 weeks without lactose or fermenting foods.
Mm.
And this particular lady is like, oh, I've tried to stay away from gluten. I saw that on a TikTok somewhere.
Mhm.
But I'm like, have you officially avoided all gluten for 3 weeks? Which she never did.
Mm.
So for all of you out there, when you're interviewing a chronic abdominal pain with diarrhea, constipation, working up irritable bowel, very easy, try to be gluten-free. Stay away from the protein and all that wheat, barley, rice, things like that. And then after a trial of no gluten, also try no lactose. And how many of us out there tell patients we love kimchi, we love kombucha, we love apple
Mhm.
cider vinegar? But Michelle, there's actually some good data that shows a lot of those fermenting foods may actually exacerbate IBS.
Yeah,
I've
it's
had
a
patients,
fine line.
yeah, it's a very fine line. So
Yeah.
I always tell people, do me a favor, for as much as you're suffering, try, 2 weeks without any fermenting foods,
Mhm.
really at all. You know what I
Mhm.
mean?
Mhm.
So she came to me, she was having these chronic stomach aches, abdominal pain, which she really talked about, as like a cramping, twisting type of pain.
Mhm.
And it's funny, she never gave me a clear answer. Sometimes she thought that these loose stools cleared up her abdominal pain, and sometimes she thought the loose stools actually made her abdominal pain worse,
Mhm.
right?
Mhm.
And the pain can range from very mild to actually severe, where she was using sick days, for example.
Oh.
So, and again, one of the other things that we picked up on is that not only was she feeling more gassy and bloaty, but those were giving her more discomfort
Mhm.
along the way at the same time. Like a lot of IBS patients, they have that sensation of like incomplete emptying. She's like, I had diarrhea, but then like 5 or 10 minutes later, I thought that I was going to have it all over again.
Mhm.
So there is a criteria out there called the Rome 4 criteria.
Yep.
And people, there's an app for that. You could download it on your phone. And officially, to have IBS, you have to meet the Rome 4 criteria, which is recurrent abdominal pain, where you have pain at least once a week for the last 3 months, and it's related to defecation and a change in stool frequency, either diarrhea or constipation, or alternating back and forth, alternating either constipation or diarrhea. And Michelle, I'm glad people are tuning in, because I'm going to tell everybody a really cool secret. The Rome Foundation is going to be soon publishing the Rome 5 criteria.
Oh, nice.
Yeah, and get a load of this. It includes checking on the gut microbiome and including brain gut treatment as part of management of irritable bowel. And
That's
Michelle,
wonderful.
when I was reading this, I was actually rubbing my computer screen. I thought that maybe it was a mistake. So people, everything we're talking about, using Omni-Biotic AB10, using food elimination,
Mhm.
it's all coming into mainstream more and more and more, which I really think is um, really exciting.
Yeah, it is.
Right,
It's encouraging.
right.
Yeah.
Now, when she came into the office, we do a good abdominal exam. And with irritable bowel syndrome, sometimes their physical exam is normal. This lady had a little bit of dry mucous membranes, probably just from losing more water than she's bringing in. She had a little bit of tenderness to like abdominal palpation, and she was hypertympanic, like she was very gassy, which you can actually pick up on when you do like a bedside
Mhm.
ultrasound, for example. And there is an interesting correlation when we do her blood work We do basic things like red blood cells, white blood cells, liver, kidneys. She did have an elevated C-reactive protein, which is a measure for inflammation.
Mm-hmm.
And she did have a low vitamin D like dog,
Mm-hmm.
both a low vitamin D number 2, which was
Mm-hmm.
less than 4, and a low vitamin D3, which was only 18. And there is a good
Oh.
correlation between IBS and low vitamin D.
Mm-hmm.
So all of you listeners, if you're taking notes, if you're able to order blood work, remember to order a vitamin D number 2 and vitamin D number 3. Vitamin D number 2 being more of a prohormone. It's important to know the difference between those two. She did have negative celiac serologies.
Okay.
She had negative blood and white blood cells in her stool, but she did have fecal calprotectin and lactoferrin, which is a classic test we would do for loose stool and diarrhea.
What was her
And
calprotectin? Do you remember?
so I don't have the number in front of me,
But it
but
was elevated.
definitely, yeah, it was definitely
Okay.
elevated for sure. So, and she did do a SIBO. We did the SIBO breath test, which
Mm-hmm.
did show some evidence that she had some small bacterial infection. So again, with that first visit, we did a really good history. We figured out that she was on that safari and there might have been a triggering event
Mm-hmm.
in addition to her going to high school, I'm sorry, college. And then number 2, I really started her on that rotational type diet
Mm-hmm.
and really keep like a good inventory of what you eat and how your bowels react.
And on those
Now,
stool tests, was her microbiome altered at all, like a low diversity or
yeah,
anything along those
she
lines?
had very low E. coli. She had very low lactobacillus. She had a low immunoglobulin A in her blood, which also shows, evidence for
Mm-hmm.
very low diversity, which up to date now is talking about as being important with IBS for sure.
Nice.
So,
Cool.
so most of us hopefully out there remember that the FODMAP diet is the classic diet to start with IBS. But I didn't start her on that right away, just I had her start with avoiding gluten, then avoiding lactose, then avoiding fermenting foods. And I had her avoid fermenting foods because she was like feeling so gassy,
Mm-hmm.
you know what I mean? And then at her second visit, where she thought maybe going off of some of those irritating foods did seem to help, I had her try that low FODMAP diet. Now, also, if we go back to that up-to-date website, which is kind of got all the latest and greatest data, they do point out that probiotics are exceptionally good for IBS with diarrhea, which is what this lady is really dealing with. And, I had her do the Omni-Biotic AB10
Mm-hmm.
because it has 4 strains, 5 actually, trying to picture the label, of the different types of lactobacillus,
Mm-hmm.
also has bifidobacterium in it. And one of the things that makes the AB10 unique is it does have a strain of Enterococcus fecalum in there, and that Enterococcus really helps to restore that IgA producing gut mucosa.
Mm-hmm.
So one of the things that I like to do with the AB10 is I have them put half of the packet in water and drink it. And I have them put the other half of the packet on their tongue. So it kind of treats their upper GI system. Because when you're drinking that Omni-Biotic AB10, it gets down into the gut, starts in
Mm-hmm.
the stomach. But there's something magical about treating the mouth and that upper esophagus as well.
Nice.
So that's definitely a classic there.
Do you have any issues with compliance with that?
Some people thought that it was a little too powdery
Mm-hmm.
in their mouth, but I'm like, you could, after you let it settle in, you could drink it down with a little bit of
Mhm.
water. But I tell them, I'm like, I really want that all over your tongue. I want that on the back of your throat. I want you swallowing a little bit of it to get it into your food pipe. And most people find that it actually helps with their gas. And I have a few patients, rather than chewing on an over-the-counter antacid, they're like, if I'm feeling gassy, bloaty, acidy heartburn, I'll just sprinkle a little bit of the AB10 right in my mouth, and that actually works better than like Pepto-Bismol, which I think
Oh,
is
wow.
fantastic.
That
So,
is wonderful.
right. So here's another great trick. We know that the other thing I'm really always excited to talk about is the fiber crisis in America. And we know that people should, everybody, healthy people and non-healthy people, should get 25 to 30 grams of
Mhm.
fiber, Michelle, every single day.
Mhm.
But some people only get 8 or 10 grams of fiber. Write this
Mhm.
down. We're in a fiber emergency. And remember that you can't go wrong as a clinician. Fiber can speed you up if you're constipated, and fiber can slow you down if you're having constipation.
It's the
So
great
on that
equalizer.
second, yeah, it's a great equalizer. Yeah, I thought I saw that on a bumper sticker once. So yeah, so the fiber, I definitely added in that second visit as well. And once we were able to figure out that she really did have some SIBO going, I started her on the Xifaxan or
Mhm.
rifaximin
Mhm.
550 twice a day for 3 weeks, which really helped to kind of reduce her loose stools slightly as well. So the rifaximin, it's well known that you can do 2 or 3 weeks of rifaximin and patients can get 4 to 6 months of relief.
Mhm.
So I'll tell patients, get 42 pills of rifaximin in, keep going with either FODMAPs or the avoidance diet, get the fiber, do the Omni-Biotic AB10 half and half in
Mhm.
the mouth, half in the gut. And some patients have to start doing that twice a day
Mhm.
until their immunoglobulin A level actually starts getting into the 200s. And the secret is when I give patients the Xifaxan, I always give them a refill because I tell patients, if you notice your symptoms start coming back, automatically do a second course of 42 pills. So,
Mhm.
and guess what? What was this 33-year-old lady worried about? She didn't want to go to a conference because she didn't want to have diarrhea at the meeting. She was afraid about, going out on dates. And sometimes I'll tell patients, if you want to do a little loperamide, which is over-the-counter
Right.
Imodium, as long as we know there's no infection remaining, I'm like, take a half of an Imodium, and that should help you have a first date, second
Mhm.
date, prevent you from running to the bathroom or be able to sit through a movie.
Yeah, you have to balance that quality of life. We want minimal intervention, but by the same token, they have to have a good quality of life.
Right.
Hopefully, even in the interim of cleaning up all of the stuff and resolving the case.
Right,
Yeah.
exactly. And again, this lady was starting to develop some anxiety. So
Yeah.
if a half of an Imodium will get her back out into society, I don't necessarily think that's a big deal.
Yeah.
So also, for those of you that write prescriptions, there's that old-fashioned binding agent called cholestyramine or Questran,
Mhm.
which was originally used for cholesterol, but has been used more and more for biotoxin illness. And cholestyramine, as a great binder, has constipation as a side effect. So that is also an option to use for these patients who are plagued with loose stools as they are, going through the treatment process for sure.
Mm-hmm.
And serum-derived bovine immunoglobulin. There's a prescription called Interrogam, and there are lots of over-the-counter products. Using serum-derived bovine immunoglobulin is great for these loose stools also, for example. So as this lady was going through the treatment course, it was interesting that she noticed a reduction in her loose stools, not only with FODMAP and the addition of the AB10 probiotic and the rifaximin. And it was really once we started adding in the fiber and really working on her immunoglobulin A, adding in some aloe juice, good quality aloe juice, not the stuff filled with sugar like from the fast food store, that she really started noticing that her gas and bloating started to improve. Now, this lady had been dealing with some type of diarrhea in one way or another for almost a decade.
Oh,
And it
wow.
was interesting to see in about 3 or 4 months that her bowels really started to regulate herself better, that she started to have better mood. She was enjoying work more, getting out socially as well. So, I thought that really started to come to fruition. And of course, there were lots of phone calls and blood work
Yeah.
follow-up, but that's kind of the core principles of what we did for this lady.
Did you do a follow-up stool test to double check the calprotectin and that kind of stuff?
That was actually not covered by her insurance. So I'm like, hey, as long as you're feeling better, why don't you spend your money on keeping your probiotic supply going?
Yeah. Yeah.
So, but yeah, a lot of people want to look to see if those things are improved afterwards. So, through like LabCorp Quest, we can do like fecal pH and fecal white blood cells, but a lot of, practitioners listening to this video know that sometimes it's a choice between purchasing healthy food, purchasing your supplements, and getting some of these really advanced, cool kind of testings done. So
yeah,
we definitely did it in the beginning because we needed that data.
Yeah.
So
yeah, it's hard to get. It is frequently difficult to get the follow-up test when they're feeling better.
yeah, they
It's
don't want to come
hard.
back. And in a way, I can't blame them.
And they don't want to pay, at the beginning, it made complete sense to pay that money. And then now that they're feeling better, it's a little bit of a difficult sell.
Right.
Yeah,
Exactly.
I get that.
Right.
That's a really great case. Anything else you would like to add about that IBS case?
Yeah, so I think, just to summarize for everybody out there taking notes, IBS, irritable bowel syndrome, they have to have some degree of abdominal pain, and they have to have some change in defecation, either constipation or diarrhea, or alternating between both of them. Again, don't be that person that labels someone with IBS because you can't figure out, oh, is this really celiac? Is this, really like a gluten sensitivity? Is this something somatic, like neurologic? Is this a vagus nerve issue? So, really hone in on those symptoms to properly label your patients. And again, like I said, when, I'm treating with probiotics, whether you're using a powder or a capsule, don't forget the mouth, the throat, and the esophagus. Treat that as aggressively as you do the stomach and below.
That's a great tip.
Aloe juice is great. Everybody needs fiber. Really have them keep a food and symptom diary as well.
Yeah.
And again, the AB10 is the unique probiotic on the market that has that Enterococcus, which I have not found in any of the other competitors.
Yeah, it's a rare ingredient. It's a normally found microorganism in a healthy GI, and it's one of those commensals. You need it. It can become problematic if it gets too much, but it's also problematic if you don't have enough. So you've got to keep it in that nice little mid-range. And I agree, it's one of the reasons AB10 is so unique and works, I personally think works so well, because it has that like fundamental microorganism in it.
Right, exactly. Yes, fantastic.
Wonderful. Thank you very much for your time today and for sharing your case with us.